welcome to our program Doctor, and today my topic is heart disease. Cardiovascular disease or heart disease is a class of diseases in which there is a involvement of heart or blood vessels like arteries, capillaries and veins, or involvement of both heart and blood vessels. And cardiovascular disease refers to any disease that affects the cardiovascular system, principally cardiac disease and vascular diseases of the brain and kidney and peripheral arterial diseases. Atherosclerosis and hypertension are the most common causes for the cardiovascular diseases. And also cardiovascular disease is the leading cause of deaths worldwide. Coming to the types of heart disease. Coronary artery disease, also called as ischemic heart disease and coronary heart disease, and heart failure, cardiomyopathy, diseases of the cardiac muscle, hypertensive heart disease, and cor pulmonale, a failure at the right side of the heart with involvement of respiratory system. Cardiac dysarrhythmias, abnormalities of cardiac rhythm, and inflammatory heart disease in which there is a endocarditis, inflammation of the inner layer of the heart, the endocardium, then inflammatory cardiomegaly, and also myocarditis, inflammation of the myocardium, the muscular part of the heart. And other types of heart diseases are valvular heart disease, cerebrovascular disease such as stroke. It is a disease of blood vessels that supplies the blood to the brain. And peripheral arterial disease, it is a disease of the blood vessels that supply blood to the legs and arms. And then congenital heart disease, heart structure malformations existing at birth. And one more important heart disease is rheumatic heart disease, in which there is a heart muscle and valves damage due to rheumatic fever caused by the streptococcal bacterial infections. So these are the important types of heart diseases. Coming to the risk factors for the heart diseases. These are age, sex, hyperlipidemia, high blood pressure, diabetes, lack of physical activity, increased alcohol consumption, increased sugar consumption, obesity, psychosocial factors, and also air pollution. And I want to mention one important word, Serrano's cardiac triad, in which there is a three important diseases which are responsible for the cardiovascular disease. These are hypertension, hyperlipidemia and diabetes. Age is very important risk factor in developing cardiac diseases. Approximately 85% of the deaths due to coronary artery diseases are at the age of 65 or over 65. The most important reason is, in most of the populations, the serum total cholesterol level increases as age increases. And aging is also associated with changes in the mechanical and structural properties of the vascular wall, which leads to the loss of arterial elasticity and reduced arterial compliance, which subsequently leads to the coronary artery diseases. Coming to the sex, men are greater risk to develop the coronary artery diseases than premenopausal women. Among middle-aged people, coronary artery disease is 2 to 5 times more common in men than women. And among women, estrogen is the predominant sex hormone, and estrogen may have protective effects through glucose metabolism and hemostatic system. And the production of estrogen may decrease after menopause, and it may change the female lipid metabolism, so it can increase the production of LDL, that is bad cholesterol, and decrease the production of the HDL, that is good cholesterol. And among men and women, there are notable changes in body weight, height, body fat distribution, heart rate, stroke volume, and arterial compliance. So older age group people are more prone to heart diseases, and also men are at higher risk to develop the cardiovascular diseases than women. Coming to the screening tests for the heart diseases, the first and foremost important screening test is ECG, electrocardiogram, and also some biomarkers may reflect the higher risk of cardiovascular diseases. These are coronary artery calcification, carotid intima media thickness, carotid total plaque area, elevated homocysteine, and elevated low density lipoprotein, and elevated blood levels of brain natriuretic peptide. So these are the screening tests for the heart disease. Coming to the prevention of heart diseases, intake of low fat food and high fiber content includes whole grains, fresh fruits and vegetables may help to reduce the heart diseases. And tobacco cessation, limit alcohol consumption may help. If blood pressure is elevated, should take precautions to lower the blood pressure. It helps the prevention of coronary artery diseases. And decrease the sugar consumption and also decrease the psychosocial stress may help to prevention of the heart diseases. Diet plays a very important role for the prevention of the heart diseases. The DASH diet helps to prevent the heart diseases. DASH means dietary approaches to stop hypertension, and it is a dietary pattern promoted by US-based National Heart, Lung and Blood Institute of Health to prevent the hypertension. And the DASH diet is rich in fruits, vegetables, whole grains and low-fat food, includes meat, poultry, fish, nuts and beans. Coming to the medication, statins are effective in preventing the further cardiovascular disease in people who have history of cardiovascular disease. And aspirin may help to prevent the heart attack or stroke. Coming to the management, cardiovascular disease is treatable with initial treatment with primarily focused on diet and lifestyle interventions. So my dear friends, take care of your health. As we all know, health is wealth. So thanks for watching. See you with another topic in next episode. Till then, take care.